Hi, everyone. Welcome and hello. This is Amy Webb, member of the Nhsn AUR team as part of our CDA team. Just wanted to welcome you and thanks for joining today. We are going to get started because we have a packed agenda for today. Just a few housekeeping items before we get started. The slides were emailed to our vendor distribution list this morning, so you should have them in your inbox. If you did not get the slides and or the original meeting invite, please email us at nhsncda@cdc.gov to be added to that list. This call is being recorded, and we do plan to post it on our website. That process usually takes us about 4 to 6 weeks to get posted, though. We have a large number of presenters today, so we'll save the official Q&A until the end of the slides. But if you do have questions related to the webinar content, please put those in the Q&A box. We will be monitoring that box and trying to either type in our responses during the call, or we'll answer it live at the end of the webinar. If you have technical questions related to the webinar itself, like if you hear an echo or can't see the slides, please put those in the chat box. With that, I'll turn it over to Joseph to start us off. Joseph.
Hello, everyone. Welcome to the summer 2022 CDA vendor webinar. We have the topics for today are as follows. First off, we're going to start with Dr. Andrea Bennin to talk about some future initiatives in the Nhsn surveillance space. Then we'll be talking about some general release updates for various components, COVID-19, patient safety, long-term care, followed by some updates for the vendor IDM, updates about vocabulary for CDA, a gender variable update that's coming at the end of this year for early next year. Amy and team will be talking about the antibiotic use and resistance module updates. We have Latasha and Shwai, who will be talking about late onset sepsis and meningitis, our new neonatal component. Then there will be some discussion about the Nhsn pre-production test suite, Nppd, followed by some miscellaneous slides and Q&A. Amy, next slide. So I'm going to turn this over to Dr. Andrea Bennin so that she can give some highlights and discuss future initiatives.
Thank you, Joseph, and thank you everyone for joining us today on this call. We really appreciate your time and effort in regards to Nhsn. So we do have some new initiatives that will be coming out over the course of the next year or two. We don't have the details for you on these initiatives today, but we wanted to at least give you some previews around what is coming. So as you can see on the slide that Joseph and Amy are showing here, in the top of the slide, we have a new component actually that is underway that will have, for starters, some measures around glycemic control. And those measures, there's a measure around hypoglycemia, and then ultimately there's a measure around hyperglycemia also, which is going to be secondary. With all of these measures that we're undertaking on this list, we are going to be looking at ways to collect data in a line level fashion so that we will be able to answer to the need that has been expressed to us to be able to have more robust risk adjustment, which requires us having the line level data. So all of these measures will fall into that category. we will be coming out with a revised measure for C. difficile. This will be a measure that's slightly enhanced over the current C. difficile measure. And that measure is likely to come out at about the same time as the hospital onset bacteremia measure. And we would expect both of those to be ready sometime during 2023 with implementation guides, et cetera, at some point in 2023. We also are working on a respiratory pathogens surveillance module, which would enable us to capture hospital onset and hospital related respiratory pathogens, really respiratory viruses. In addition, we're working on a venous thromboembolism measures. These are known measures that are currently used as part of the ECQM program, and we are evaluating the potential ability for us to use the same files for that measure that are being used currently, as we're working on a portfolio of measures in the venous thromboembolism space. And then in more down the line, we would expect to be developing some measures around sepsis and non-ventilator pneumonia. Those will not likely be in 2023, but those are farther down the line. And we just wanted to give you a sense of some of the things that are underway. So thank you all for being here. And I'm going to hand the microphone, so to speak, back to Joseph to walk through the agenda items today, but we're happy to take questions. Thank you so much.
Thank you, Andrea. So we're going to talk about general NHSN release updates. Amy, next slide. So release schedule overview. We're continuing to do one major release a year. That's normally at the end of the year. Changes include protocol changes, transition to new CDA versions due to some of those protocol changes. And as a reminder, those changes are always effective January 1st of every year. We have non-major releases that have been going on throughout the year. They occur on a 6 to 8 week cadence. And those releases include, which will be coming up, we'll be discussing that at a separate webinar, new components, minor change requests, defect resolutions, and some infrastructure and maintenance support. Normally, everyone is notified through messaging alert when logging into NHSN, and we are looking to improve that notification. Amy, next slide. So upcoming releases for NHSN, we have a release coming up in July 30, release 10.1.4 to fix defects that have been coming in over the year, and also change requests. Again, another release coming up in September, early September, 10.1.5, which will include defects and fixes. There are change requests as well, mostly related to COVID, but not always related to COVID. There are other change requests that can be done during the course of a year that aren't dependent on the first of the year. Amy, next slide. So in October, we are going to release 11.0. 11.0 is a release that's going to include some of the features on a test spaces for the medication safety component. We will be doing some beta testing alpha beta testing with a select group of folks that have already been selected to help us determine if we're heading in the right direction and if we're doing correct things there. Again, October 20, and those CRs for medication safety hypoglycemia will be effective October 21st, 2022. And then, of course, we have our end of year release scheduled for December 10. And again, the same kind of drill where we're deploying fixes for defects and new CRs. The CRs that normally get deployed at the end of the year, again, are related to protocol changes, new survey work, that kind of thing. Amy, next slide. So I'm going to introduce Sylvia Schuler, who will be giving us an update on the COVID-19 modules. Sylvia. Next slide, Amy, please.
Hello, everyone. Thanks, Joseph. I'm Sylvia Schuler, and I'm a business analyst and quality assurance analyst on the Nhsn project. I have been on the Nhsn project for 2 years now, and this is my first time participating in the CDA in the webinar. I also help with the iSupport tickets that are open related to issues reported for CDA submissions. I'm sure I've had communication with many of you while working through the tickets, and I want to say thanks to all of you for your assistance and patience in helping to troubleshoot and resolve those issues. I'm going to go ahead and get started now with providing information about the COVID-19 module. Currently, long-term care and dialysis facilities are reporting in the COVID-19 module. COVID-19 vaccination data is being reported in the long-term care component, the healthcare personnel safety component, mostly dialysis facilities, and the dialysis component. If you're not familiar with the COVID module, please visit the Nhsn website. Each module has previously recorded webinars and training information. You can also find guidance on different pathways, the table of instructions for required fields that are collected, CSV upload guidance, CSV templates, and other documents that will help you get started. Next slide. Long-term care facilities, there are now only 5 pathways being reported: resident impact and facility capacity, staff and personnel impact, therapeutics, vaccinations, and point of care testing. The supplies and personnel protective equipment pathway is no longer being reported for long-term care facilities, effective of release 10.1.3.3 that was deployed on May 26 of 2022. Next slide. The dialysis COVID-19 module accepts the following pathways using a single data entry page with 4 sections: patient impact, staff and personnel impact, supply and personal protective equipment, and lab testing. This module also has COVID-19 vaccination modules for reporting patient and staff status. Next slide. Direct CSV submissions is now available for long-term care and dialysis pathways, POC testing, and vaccination uploads for long-term care, dialysis, and healthcare personnel safety components. The accepted file formats are either CSV or HL7 2.5.1. Instructions on how to sign up for use of these methods are available on the Nhsn website at the links provided in this slide. As a reminder to those who may not be familiar with Direct, this is not a requirement. It is simply another method to import your COVID-19 data into Nhsn. There are templates for each accessible CSV file, and those can be found on the long-term care webpage. Next slide. Both modules, training videos are available for each component. Please visit the NHSN website to find current CSV templates and other information for both long-term care and dialysis components. If you'd like to learn more information or have questions after visiting the website, please send an email to the main NHSN help desk at nhsn@cdc.gov. Next slide. Now I will cover updates for the patient safety component for release 10.1. Next slide. 10.1.3, sorry. In release 10.1.3, there was a defect open to correct antibiogram for Antimicrobial-2B_PS for the CFEP drug, where the susceptibilities were shown as SIRN for 2022 pathogens that were following the Antimicrobial-2B_PS antibiogram. This has been corrected to now show as SI/S-DD-RN, which also reflects what is documented in the IDM 10.1 for vendor spreadsheet posted on the NHSN resource website. But as a note, NHSN accepts either S-DD or SDD with no dash for CDA import. Next slide. This slide, I will cover plan initiatives for long-term care component for release 10.1.5, scheduled for September 2022. Next slide. Currently, users can manually enter long-term care facility lab ID events for CDI and MDROs in the UI only. Over the next several months, we will begin to build the ability to accept CDAs for long-term care facilities, lab ID events for CDI and MDROs. More detail to come once the initiative gets underway. Now, I will turn it over to my colleague, Hamna Bey, who will cover the updates for patient safety component for release 11.1.0.
Thanks, Sylvia. Hello, I'm Hamna Bey. I'm a business analyst and a quality assurance analyst on the NHSN project. And soon I will start providing support for iSupport tickets relating to the issue reported for Cda submissions. I have been on the NHSN project for 3 months, and this is my first time participating in the webinar for vendors. In the next slides, I will be covering the change request plan for the patient safety component for release 11.1.0. Next slide, please. We have 6 planned CRs for release 11.1.0. CR 3680, PED VAE, update to antimicrobial list within NHSN application on the patient safety component for all the locations starting from January 2023. CR 3700, VAE calculator, update to antimicrobial list within the website on the patient safety component for all the locations starting from January 2023. CR 3702, specific event criteria BRST3 removed as a selection for SSI BRST entry. BRST3 will no longer be available for SSI BRST. CR 3713, 2023 pathogen code updates for all the components within the application. CR 3712 will remove CLIP as an in-plan option on the patient safety component monthly reporting plan for all the locations starting from January 2023. CLIP is being retired as an in-plan option for reporting in 2023, but will still be available for off-plan reporting. Note, CLIP is one of the events that can be imported via CDA. When we go off-plan reporting for CLIP, those facilities that are currently submitting CDA files will no longer be able to do so. Events for CDA imports are required to be in plan. CR 2725 will address the gender identity and sex at birth and will impact all components. Details about this CR will be discussed later by Henrietta Smith. For the next slide, I will pass it over to my colleague Joseph, who will cover vendor IDM update. Thank you.
Thank you, Hamna. Amy, will you advance the next slide, please? There have been a few corrections, updates to the vendor IDM. Some of the, all of these are currently working correctly in the application. So this is really an update to make corrections. So there is less confusion, and I want to thank my friends at Epic for bringing the first one to the list, where we're removing signs, other signs and symptoms as an option for the conjunctivitis specific event criteria. So previously there were several rules for conjunctivitis specific criteria. Now there's only one main rule with a lot of and or statements in there. And Hamna told you about the specific event criteria for BRST 3702, which will be updated for, which we will update the vendor IDM for release 11.1. We will notify you when the final versions of these IDMs are posted. The interim version for conjunctivitis and the vendor IDM for the winter release. We're still working on those. Amy, next slide. Next, we'll talk about HAI vocabulary. Next slide, please. The vocabulary group has asked me to announce that there will be a pathogen codes update for January 2023 for the 11.1 release. And to remind everyone that value sets specified in CDA implementation guides that have been distributed in the spreadsheet HAI underscore VOC.XLSX are now available in VSAC, which is the Value Set Authority Center. And we have provided a link to that website. Amy, next slide. Now I'm going to turn the call over to Henrietta Smith so that she can give us an update on the gender variable update. Henrietta, are you on?
I am, Joseph, and thanks so much for the opportunity to talk about this update. I'm Henrietta Smith, and I'm the team lead for the protocol and training team. Next slide, please. There are two new variables that are being added. The value sets in use for these two new variables are or will be in the CDA implementation guide. The two new variables are birth, sex, and gender identity. Next slide, please. The timeline for the addition of these two new variables is here outlined for the IG, the update of the IG. We anticipate that these variables will be fully published in the IG by the end of July. Next slide, please. Birth sex, defined as the sex assigned at birth. This is intended to capture administrative sex. The options are listed here, and these are the same options that are currently available for the NHSN gender variable. Next slide, please. And this is just a quick look at the birth sex VSAC value set. This was provided generously by Sarah Gaunt with the Lantana Consulting Group. Next slide, please. The gender identity variable is defined as the gender as reported by the patient. And the options that are available for reporting this variable is listed here. Next slide, please. And the next couple of slides are screenshots that Sarah provided that actually list the VSEC variable value set. Excuse me. Next slide. Again, a couple more views of the VSEC value set. Next slide. And this last slide shows that for the gender identity, there are two null flavors, ask but unknown and other. Next slide, please. The timeline for implementation within the application of these two variables, it will be optional for reporting in January 1 of 2023, manual entry and CSV import. During this time period, this optional reporting time period, the current gender field will also be available as will remain as required. And reporting will be required in 2022 as a required element. CDA import will be available during that time frame. And at that time, the current gender field will be inactivated. Joseph, do you have anything to add?
No, I don't. Well, I do actually.
Okay.
There's one thing. So with the current gender field, male, female, unknown, if once that's filled in, I believe we're going to automatically fill in the sex at birth field on the screens and in the database as a help. But like you said, starting in January of 2024, when our current gender field is no longer available, it will have to be a required field that you fill in yourselves. That's where we're at with that. Over.
Thank you. Next slide. Any questions about these new variables, feel free to send them our way. Thank you. That's all, Amy.
Thanks. And next up, we'll start our AUR module updates, and I'll pass it over to Melissa.
Thanks, Amy. Hi, I'm Melissa Mojica, and I'm one of the subject matter experts for the AUR team, and I'll be discussing what has happened since October. Next slide, please. Our team has made several updates for both the AU and AR modules. The AR summary files can now be used to upload for outpatient locations, and AU 2022 data now requires drugs to use RX norm only, and there have also been 2 new COVID drugs required for AU reporting beginning with March 2022. Facilities can also report data from new overflow location types, and I will discuss all of these in further detail in the next few slides. Next slide, please. Beginning with 2021, facilities should now report the AR option summary records, also known as the denominator data, for their outpatient locations, such as the emergency department location, pediatric emergency department, and 24 hours observation area. These summary records will report the total numbers of patient encounters for each location and month. Please note, this feature was rolled out in the summer of 2021, but functionality was backdated to apply for all of 2021. Since this update, there has been a lot of confusion by the facilities as to where to find these files within the vendor system. Next slide, please. Our team would greatly appreciate if you can all share the information listed in this slide with your client facilities. Does the software currently generate 2022 AR option summary files for the ED, pediatric ED, and 24-hour observation area? Is the software able to retrospectively generate 2021 AR option summary files for the outpatient locations? And if so, please share where they are located. If software is not able to currently generate the AR option summary files, is there a future update planned for your software? If yes, when can client facilities expect to see these new files? And also, if these files are not available within your vendor system, please instruct your client facilities to edit their monthly reporting plans to remove the checkbox in the AR option column on the rows for the outpatient locations. Next slide, please. Beginning with 2022, the AU option now requires drugs to use the RX norm codes. There have been 8 drugs that were updated with the RX norm codes. We ask that vendors review their facilities' data feeds to make sure the RX norm codes are being rolled up and reported using the ingredient level code. Next slide, please. You will find the RX norm codes in column B in the list of antimicrobial agents eligible for the AUR module spreadsheet, as noted in the screenshot. These are also found in the IDM. Next slide. The team has also added 2 required COVID antiviral agents, molnupiravir and nirmatrelvir, for the AU option beginning with March 2022. If these are not included in files beginning with March 2022, they will fail to upload. However, these drugs are optional for January and February 2022 and will upload with or without them for those 2 months. These drugs have also been added to the list of antimicrobial agents as well. Next slide, please. Facilities now have the option to report 2 new overflow locations: the on-site overflow critical care and on-site overflow ward. As a reminder, facilities reporting data from these locations should also include them in the fact-wide counts. Details such as the Nhsn location code, CDC location code, and location description can be found in Chapter 15 of the AUR protocol. There is a link to this document in the slide for your convenience. Thank you. Next up is my colleague, Amy.
Thanks, Melissa. Next up, we have a couple items to share that are currently slated for the fall of 2022 NHSN releases. So CR 3604 is related to CDA in that we'll be updating the message that's displayed during the manual CDA upload process. Currently, the same message appears, see the screenshot here on this slide, regardless of how many files within the zip actually successfully upload into NHSN. As you can imagine, most people see the green check mark and assume all's good to go, when in many cases, 1 or more files could have failed to upload into NHSN. Our plan is to update the pop-up message to make the upload results a little more clear, hopefully prompting users to click the Show Report button and ultimately help users have a better understanding of the CDA data upload process. And another change that doesn't require any action on your part, but we wanted to make you aware of, the AUR team has been working hard on developing benchmark metrics for the AR option. These 2 new metrics are currently slated for the fall 2022 releases, and we'll use the 2019 as the baseline year. The standardized resistant infection ratio, or SRIR, will be available for specific phenotypes, as shown on the next slide. And the pathogen-specific standardized infection ratio, PSIR, will be available for specific pathogens, as shown in 2 slides. You can see the phenotypes included in the SRIR metric on this slide. Additional definitions are available in the footnotes. And these are the pathogens that will be included in the PSIR metric. Next, we're moving on to the AUR changes within release 11.1, currently slated for December. I'll turn it over to my colleague, Laura, to start us off. Laura.
Thank you, Amy. My name is Laura Blum, and I'm one of the subject matter experts working on the NHSN AUR module. First, I'd like to go over change request 3219, which will revise the list of accepted AR option specimen source codes to bring them up to date with current standards. These changes will be reflected in the specimen source tab in the IDM. We plan to add over 60 specimen source codes, mostly to lower respiratory tract, to include specimens from lung transplant and specific collection methods, such as fine needle aspiration biopsy or bronchial brushing. We plan to remove 20 specimen source codes, mostly from urine and blood, to eliminate specimens collected using non-sterile procedures. We plan to align less than 5 display name discrepancies between the IDM and Value Set Authority Center. Display name changes affect human readable elements only and will not affect what's accepted by NHSN. Next slide. Change request 3519 encompasses AR option pathogen updates for 2023. At this time, we plan to only make updates to the AR option pathogen rollup workbook available in the AR Cda Toolkit. We plan to add newly available and more specific codes, remove inactive or irrelevant codes, and revise our descriptions to align with the SNOMED CT descriptions. None of these changes will affect what's accepted by NHSN. Next slide. Change request 3714 will update the display name for code IMI-PWC from imipenem with cylostatin to imipenem. This is a human readable change only and will not affect what's accepted by NHSN. This change reflects the true susceptibility test completed by labs and aligns with the LOINC code's description. Cylostatin is not an antimicrobial. It's a statin that enhances the effect of imipenem when administered together in certain situations. Cylostatin is not included in susceptibility tests for imipenem. Now I'll hand it back over to Amy to go over some more items from the December release.
Thanks, Laura. As many of you are aware, we've made additions and removals to the list of drugs included in the AU option over the last several years. As of today, we have no planned additions or removals for 2023 AU reporting. However, this CR will be making a change to how the AU CDA files are validated. Currently, aside from the 3 COVID drugs, NHSN is simply looking for a range of drugs to be included in the AU file. Beginning with January 2023 records and forward, NHSN will specifically validate that all the drugs in the antimicrobial ingredients tab are included in the file. There are currently 95 drugs in the antimicrobial ingredients 2022 tab of the IDM. So assuming there are no drugs of interest approved by FDA in the next few months, your 2023 AU CDA files will need to include the exact 95 drugs listed in that IDM tab. CR 2725 was already covered by Henrietta, but we wanted to make the connection that these 2 fields will also be added to the AR event CDA. Because AR events are entered into NHSN via CDA only, there's no way to optionally report these fields in calendar year 2023. We'll need to wait until the IG has been updated and the updates are built into NHSN, which is estimated to take place for January 2024. CR 3550 doesn't have direct CDA impact, but we wanted to let you know we'll be updating the language throughout the NHSN application from the Meaningful Use program to the new name Promoting Interoperability Program. We've already made that change on our public-facing website as shown in the screenshot on this slide. And lastly, CR 3163 will verify that a vendor has passed AR synthetic dataset validation beginning with 2023 AR events and summary records. The 2023 AR files will fail to upload into NHSN if they do not contain the vendor OID and SDS validation ID of a passing vendor. The screenshot on this slide provides an example of the author section of a CDA file with the relevant vendor information. And now a little bit more about the AR SDS. So as shared in a recent email, the AR SDS is now available for vendors on our public SDS webpage. We've updated the link to the SDS webpage, so please take note and bookmark this new page. However, the old page will redirect you to this page. On this page, you'll find the AR SDS zip file, as well as links to the AR SDS FAQs and the AR SDS passing vendor webpage. However, I wanted to share a late-breaking update for those that are already working on AR SDS validation. We will be updating the instructions document and the answer key templates to include 3 new variables that are specific to 2022 AR data. The encounters variable will be added to the denominator answer key specifically for the eligible outpatient location types in the AR synthetic data. We're also adding the admission date and admission status variables to the numerator answer key. We decided to add these three variables because we've gotten quite a few requests for clarification on these, and we'd like to make sure everyone's correctly applying the AR option protocol rules for these variables. We don't think these additions will require updates to the actual synthetic data itself. We will send out an email to our vendor listserv when the updated instructions and answer key templates have been posted and the validation web service has been updated. So within the AR SDS zip file, you'll find the instructions, quick reference card, and the data model diagram. Like the AU SDS, you'll find the data files in both CSV and MySQL formats. And lastly, you'll find the two answer key templates, one for AR event numerators and the other for AR denominators. This slide shows at a very high level the steps to take for completing AR SDS validation. As you'll notice, they are very similar, if not almost the same as the AU SDS validation. First, you'll download the dataset and the instructions, and after thoroughly reading the instructions document, I'd recommend also reviewing the FAQs to gain additional insight for some of the more common questions that we receive. The direct link to the FAQ page is also listed on this slide. Then you'll process the AR synthetic dataset through your vendor system just like you would with your regular facility AR data. You should compile and aggregate the data following the AR option protocol. And like AU SDS validation, the AR SDS validation should also be in an Excel format. Sorry, the output should be in Excel format. Remember, AR SDS validation is intended for use in testing the numerator and denominator data compilation and aggregation, not conformance to creating the AR CDA files. Once you have those files, you would upload them, one for the AR event numerator and the other for the AR denominator, aka AR summary, to the validation web service sites. The web service will validate your files against an answer key, and you'll notice we have two validation web service links, one for validating the AR denominator and the other for validating the AR numerator. This step can be done as many times as needed to check your output against the answer key. Once you've done your own testing and received no errors from the validation web service links, you're ready to send the Nhsn team the AR Excel files in order to receive confirmation of successful validation. In addition to the Excel files, and as part of the vendor registration process, please also include the additional information listed here on the slide. Your vendor OID, vendor name, software version, at least one technical point of contact, and optionally your vendor website. As a quick aside, you will use the same vendor OID you received during the AU SDS validation process, so you do not need to apply for a second vendor OID. If any of the information listed here is missing, apart from the optional vendor website, we won't be able to process your request. After we receive information, we'll follow up with an email to ask if you'd like us to delay posting your vendor information on our website. Some of you have shared that you'd like time to incorporate the SDS validation ID into your software system and therefore want us to delay posting. So please let us know if that's the case for you. Then at that point, we would test your Excel files to confirm whether they pass AR SDS validation. If the Excel file passes, we'll send an email containing the SDS validation ID to be added to your production AR CDA files. Of note, while you'll use the same vendor OID for both AU and AR files, you will receive a separate AR-specific SDS validation ID. However, that AR-specific validation ID will be used for both your AR event and your AR denominator files. Additionally, your vendor name, and software version will be posted on our public-facing webpage. If one or both Excel files fail, we'll send an email indicating that one or both have failed, and we'll list the errors received or a subset if there are a lot of errors. Then you can resume testing internally, uploading your files to the web service tools as many times as needed in order to resolve those errors. Once ready, you would follow the steps outlined on the last slide to submit the information to us again. One of the more frequently asked questions we get is how often invalidation will be required. Just like for AU SDS validation, AR validation is expected to be completed once per vendor per software version. So starting in 2023, all vendors creating AR CDA files will need to have successfully passed the initial AR SDS validation in order for their client facilities to be able to either manually upload AR CDA files or import them via direct. No vendor will be grandfathered in. All client facilities using the same software version will have the exact same information in the author fields of their AR CDA files. The NHSN team requires you to recomplete the AR SDS validation process only when major changes have been made to the AR option protocol. However, you should also complete the revalidation process when major changes are made to your software that might understandably affect the AR data compilation and aggregation. Next, we're going to share some miscellaneous updates related to AUR. First, we wanted to share that we have a new NHSN report available that can be used as part of your real-world testing plans for ONC. This report details the number of successful and failed AU submissions by month using the vendor information included in the AU files. This report will include submissions from March 2022 forward. If you'd like us to provide this report to you, you're welcome to email us at nhsn@cdc.gov. Next, I'll turn it over to my colleague, Virgie.
Thanks, Amy. Hi, everyone. My name is Virgie Fields, and I'm a public health analyst with the NHSN AUR team. The NHSN AUR team is in the process of reviewing 2021 AU data. We have determined some discrepancies in the AU data that have been submitted. These include repeating counts for multiple drugs, incompatible drug with route, for example, reporting a drug that can only be administered via the IV route, but it was reported as being administered via another route. And then reporting of drugs that have been removed from NHSN. We plan to do a deeper dive into these discrepancies and will perform outreach to specific facilities and vendors. Next slide, please. CMS has proposed a change to the Medicare Promoting Interoperability Program. They are proposing to add a new AUR surveillance measure under the Public Health and Clinical Data Exchange objective. For the AUR surveillance measure, the eligible hospital must use CDC's NHSN to submit AUR data for the EHR reporting period and receive a report from NHSN indicating their successful submission of AUR data for the EHR reporting period, otherwise known as like the MU3 status report. They are proposing to require eligible hospitals to report this measure beginning with the EHR reporting period in calendar year 2023. Eligible hospitals must use certified technology. We have included a link on this slide to the CMS fact sheet that summarizes the changes and links to the full proposed rule in the Federal Register. The comment period for this proposed rule ended on June 17th, and the public comments were mostly positive, but a number have asked for a delay. More information will come later this year. I'll now hand it back over to Melissa to discuss recently updated AUR documents.
Thanks, Virgie. As she said, I'll be discussing some updates made to our documents. Next slide, please. The team updated the list of antimicrobial agents eligible for the AUR module workbook, and it is now available in the supporting materials section of the NHSN AUR main page. Next slide. The team made several updates to the workbook to assist analysts working with AUR data. For AU, the sheet now lists all the drugs that were ever reported for the AU option, including the first reported and last reported dates. If the drug is currently required for reporting, the last reported column will be blank. We've also illustrated these changes using colors to represent when drugs were approved by the FDA since the inception of the AU option. The drugs that were not new, but were added to the AU option due to a change in RX norm coding, and drugs that were removed from AU option reporting. You'll also notice that the values in column B have been updated to reflect the RX norm codes per the update made to the AU drugs beginning in 2022. And finally, the updated AU spreadsheet also contains the 2 new COVID drugs I discussed earlier. Next slide, please. The AR sheet of the workbook underwent significant updates as well. You'll notice the drugs are now organized into drug panels per organism or organism group. Additionally, the sheet lists the drugs included in each drug panel since the beginning of the AR option reporting in 2014. For each organism panel, you'll see when the drug was first reported and, if applicable, when it was last reported in that panel. This is also illustrated using colors like the AU tab. Lastly, you'll notice that the values have been updated to show the LOINC codes, a change effective as of January 1st, 2022. Next slide, please. The AUR Cda toolkits have been updated and posted. The AU option includes the new AU drugs and RX norm codes, and the AR option event includes specimens collected January 1st through 2022 and forward. The AR option event also now requires the use of the R3 implementation guide. The old R1 implementation guide can still be accepted for specimens collected up to December 31st, 2021. Next slide, please. The AU and AR FAQ pages have been updated to include more questions answered based on inquiries received to the iSupport AUR inbox. Links to these pages are included in the slide for your convenience. Next up are Latasha and Shwai. Thank you.
Good afternoon and thank you. I'm Latasha Boswell, the protocol subject matter expert for the late onset sepsis and meningitis module. During this section of the presentation, I'll provide a brief overview of the protocol aspect of the module. Dr. Shwai Zing will go into great detail regarding the late onset sepsis and meningitis calculator, as well as other technical aspects of our protocol. Next slide, please. So the late onset sepsis module was created in partnership with the Vermont Oxford Network and other stakeholders in 2015. Our target population are very low birth weight babies between 401 and 1,500 grams, being day of life 4 to 120. They must be housed on a level 2-3, level 3, or level 4 nursery for more than 2 calendar days. All events and denominator eligible infants are determined by the late onset sepsis meningitis calculator that was created by Dr. Shwai Zing. All events and also denominator data are uploaded CDA, and there's no manual entry of data. Next slide, please. In the late onset sepsis meningitis module, there are a total of 4 events. There are 2 that are under the late onset sepsis major type of infection and 2 under the meningitis major type of infection. So let's begin by looking at the late onset sepsis major type of infection events. So late onset sepsis events involve positive blood cultures in an eligible infant or target population. The first event is an NLCBI-1, where 1 or more positive blood specimens with a recognized pathogen are identified. In NLCBI-2, there is 1 or more positive common commensal blood cultures. In addition to them having a common commensal blood culture, they must also have a new intravenous antimicrobial agent from Table 6, and that antimicrobial agent must be initiated during the late onset sepsis min window period on or after day of life 4 and continued for at least 5 calendar days. Next slide, please. Under the meningitis major type of infection, there are also 2 events, NLCM1, where there is a positive cerebral spinal fluid with a recognized pathogen, and an NLCM2, where a positive common commensal cerebral spinal specimen is identified, and there's an intravenous antimicrobial agent started from Table 6 of the protocol, and it's initiated during the late onset sepsis min window period on or after day of life 4 and continued for at least 5 calendar days. Next slide, please. This provides an overview of our electronic data flow. So we start with the facility's electronic medical record. The data that is extracted electronically will include ADT system information, pharmaceutical information, laboratory specimens, demographic information that goes into the vendor system or the facility's reporting system. The calculator lives on the vendor side of the system, and it is used to determine not only our events, but also our denominator data. That information is then sent back to the vendor system and then uploaded to Nhsn via CDA. This concludes my portion of the presentation. I will now turn it over to Shuai Zhang. Shuai?
Yeah, no problem. So as Latasha just mentioned, in order to facilitate the facility side implementation of this module, we have packaged all the event determination procedures into a Java library and named it the LOS event calculator. So in this way, the participants of this module may focus on the data collection and aggregation processes, as well as the creation of the CDA document. In addition, you can build this Java library into your system and invoke it locally, so you don't have to send the sensitive data over the internet in this step. In general, our focus here is the determination of the denominator and the numerator event. As long as you could turn the collected data into an XML file or a Java object, the calculator library can automatically generate the event determination labels for each individual record. Next slide, please. Yeah. In addition to the Java library itself, this developer package also provides additional supporting documents, which include an example XML input file, a schema file showing the data structure of the input, and the standard Java document showing the details of the Java APIs. And in sum, we share the calculator library as a free resource so as to ease the facility side software development. Meanwhile, using this library is optional, so you may develop the programming solution of your own if necessary. Next slide, please. And once you complete the software development, you may leverage the additional validation resources to polish your implementation. We aim to mitigate the gap between the abstract protocol and the actual programming implementation. Therefore, as you know, we have developed various validation resources for different procedures. Next slide, please. This validation project and the synthetic dataset targets the data aggregation procedures. The basic idea is very similar to the existing AU and AR validation project of Nhsn. So one can import the synthetic data into their system and then abstract and aggregate values to generate the event determination output for validation purpose. Meanwhile, unlike the mandatory AU and AR validations, which leads to the official certificate, this LOS validation project is voluntary, so you can perform it in a self-validation way. And next slide, please. In particular, all the test cases and the corresponding answer key file will be made available along with the synthetic dataset. So you can just use these resources to perform the debugging process offline by yourself. At this point, the beta releases of the calculator library and the validation package will be shared upon email request. Please feel free to contact Latasha or me if you are interested in the LOS module or any of these development resources. Once we complete the beta testing, we will post these resources on our official website. We look forward to working with you on this surveillance module. Thank you very much for your support.
Thank you, Latasha and Shuai. Now I'll pass it to Hamna.
Thank you. In the next slides, I will be providing information about the Nhsn pre-production test site, Nppd. Next slide, please. Nhsn pre-production test site, or Nppd, is available for all the vendors. Nppd allows vendors to test their code in prior to Nhsn deployment. To request a test site, please follow the instructions on this slide and send complete form to the CDA team. Next slide, please. When logging into Nppd, please read important message at login. Nppd is currently on version 10.3.3.3. We will try to update it as soon as possible to allow testing for upcoming releases. Any issue found in testing, please send an email to nhsncda@cdc.gov. For the next slides, I will pass it over to my colleague Sylvia to discuss miscellaneous. Thank you.
Thanks, Hamna. On the next slides, I will cover some additional information that will provide guidance, statistics, and other resources for CDA implementation and process. Slide. This is the CDA import data comparison stats that went out on the last NHSN quarterly newsletter for Q2 of 2022. Show the CDA imports versus manual entry or CSV import for procedures. The year-date range is selected or coincide with the quarterly CMS reporting. Please note the steady increase in the CDA submissions. Slide. Update for the direct CDA automation. Traffic has continued to increase significantly. We now have approximately 59 direct addresses and over 8,600 facilities sending via direct CDA automation. For those of you who are not using direct yet, it is a batch submission process with no immediate reply. We typically request to allow 24 hours for processing. However, the turnaround time is based on the volume of messages in the queue. We do want to apologize for the intermediate direct connectivity and slow responses issues experienced over the last 2 months, but we are in the process of refreshing our servers and updating software to help mitigate the issues and are targeting to implement the new infrastructure collectively during the Q4 of this year. If you are new to Direct or want to learn more about Direct, there is a Direct Toolkit on the NHSN website. But before you start your process, we recommend that you schedule a call with us. We will be happy to discuss the Direct process and recommend the best practices. A developer and Direct administrator will join the call for all your technical discussions. Next slide. Cda support is available on the NSHN website. The first link is the main Cda Submission Support portal. Other important links provided on this slide are the Cda Toolkits and the guide to Cda versions. As a reminder, NSHS supports Cda versions that are valid for the past 2 years. Next. Listeners can also use the HL7 GitHub website for the latest IG guides and get access to the XML, related files, schematron, Cda schema, samples, and style sheets. This information can be found at the link provided on this slide. Next slide. A few more helpful resources may be found using the following links. The first one is the NSHN newsletter. Next is the release notes and communication updates. And last is the CDA webinars, which is where this video of this webinar will be posted. Next slide. Troubleshooting Cda Direct. One of the most common questions users sending via Direct is, I haven't received a direct response. for my direct messages. What are my next steps? To help assist with troubleshooting, please send an email to nhsncda@cdc.gov and provide the information listed in the table, which includes the facility name, the NHSN facility ID, the submitted date time, zip file name, and the message ID. This will allow the direct database administrator to research the issue and provide findings. Next slide. Always, we welcome any feedback. If you're not on the CDA distribution email, please let us know. The CDA team is off one-on-one quarterly meetings with vendors. Send an email to the CDA inbox if you have not had a chance to schedule a call with us and would like to. Please include any topics of discussion so that the proper team is on the call. Thanks, everyone. This includes the slides. Now we'll turn it over to Amy for questions and answers.
Thanks, Sylvia. All right. Well, thank you all to our, thanks to all our presenters on today's webinar. We've been answering some questions already in the Q&A box, but we have quite a bit more time available to answer them now. So as you can think of your questions, please type them in the Q&A box. And if we're not able to get to your question, or if you think of it after we sign off today, please always email us at nhsncda@cdc.gov.